Adaptive leadership is about how leaders encourage people to adapt when facing problems, challenges, and changes. The goal is to encourage people to change and to learn new ways to living so that they may effectively meet their challenges and grow in the process. According to our textbook, adaptive leadership assumes a service orientation, which is similar to a physician. An adaptive leader uses his or her expertise or authorities to serve the people by diagnosing their problems and helping them find solutions. So, as an APRN, we can utilize adaptive leadership to get our practice. But first of all, to be an adaptive leader, we must be able to adapt by ourselves. For example, scope of practice for APRNs is different from state to state, and APRNs in Texas, California, and some other states only has restricted medical practice for APRNs, which means we can only prescribe, diagnose, and treat patients under the oversight of the physicians. Other states like Washington, Nevada, they give APRN the full scope of practice, so they don't have to under any physician's oversight. Also, there are some other states, so they give one thing called reduced practice, scope of practice, which they can diagnose and treat patient, but for prescribing medication, APRNs still need to be under the oversight from the physician. But regarding the different scope of practice authorized by different states, so APRNs must be able to lead by example and well adapt local regulation and policies to be practiced. Next, according to American Association of Nurse Practitioners, 89% of nurse practitioner population prepare in primary care, and Association of American Medical Colleges stated by 2030, a shortage between 14,800 and 49,300 primary care physicians, and at the same time, more than 30,000 specialty providers are needed. So this creates a problem in quality of care to our patients, and also increase the provider workload, which can reduce their work satisfactions. As an adaptive leader, the APRNs can step up by taking the primary care role from the physicians and free their hands to go specialties. In the same time, increase quality of care for patients by combining the roles of providers, mentors, educators, and researchers. The cost of a medical expense is always a concern for patients and their families. To help them solve this problem, we can educate our patients that nurse practitioners are capable to provide the same level of care in primary care setting as the physician does. Build trust between APRNs and the patients can lead them to know that when they receive the same level of care, and actually they are saving money. According to a research done by Hamel and Prezad in 1994, they found that the cost of physician and a nurse practitioner team can save up to 42% compared to physician-only clinical settings. And the last thing we want to talk about is from the team-based care perspective. APRNs can serve as bridge between doctors, nurses, pharmacists, physical therapists, and patients. The patient is the center of the healthcare team. Most APRNs has quite a bit of direct patient care before we become an APRN. So communicate with doctor, pharmacists, and the patients. We are on the experts. We are on the expert sides. So as an adaptive leader, APRNs can help patients to establish goals and collaborate with physicians for treatment plans through interaction between our healthcare providers to make the best decision for our patients. And my question for this is, what do you think? What can you do if physician has put a discharge order for patient, but the patient feel he or she is not ready for go home?